Okay, hi everyone. Thank you so much for joining in. This is for the summer slash fall semester. We're just hosting our GBM a little bit later this semester. And yeah, I'm super excited to get started. I did turn on the recording. I wanted everyone to know, just because we want to make it accessible to everyone else. Who know you maybe decides to apply for OB-GYN later on in the upcoming semester or so. So I'm gonna go ahead and turn on my sharing, like sorry, start sharing my screen. Can someone come off mute and let me know if you guys can see my screen.
You can see your screen.
Okay. Perfect. Thank you so much. So I'm just gonna do slideshow. Alrighty. So as I mentioned, this is the summer fall of 2026 OB-GYN Clinical Science Interest Group e-board meeting. Thank you once again for joining everyone. And please, before we get started, if you can, click the link that was pasted in the chat. And Tara, our lovely VP, will be able to post it again periodically throughout the meeting in case you missed the first time she posted it, just so that we could get a good view of our attendance as well. And it will also help us to decide, do you want to stay on the emails? If you're not already getting the emails, you want to be added to it. So it just kind of helps with more administrative processes. So this is where I'd like to start with meeting the e-board. My name is Evelina Janison. I am the president. I'm now going to ask all of the e-board members to also unmute themselves and they will introduce themselves as well. I did my core rotations in Trinity Health in Michigan. And I also asked the e-board to share a fun fact about themselves. So my fun fact is that I love to read. I have a library of around 1,500 books right now, and hopefully it keeps growing. So yeah, I will stay quiet and I will let the next e-board member take over.
Hi, everyone. My name is Tala, and I'll be the vice president for this semester. A fun fact about me is I have lived in 5 countries so far in my life, and hopefully the number just keeps growing. And I'm currently doing my core rotations in Mount Sinai, Chicago. So if you're in the area or at Chicago too, please, you know, yeah.
Hi guys, my name is Solange and I am the secretary for the group. I currently just finished my core rotations at Miami Rescue Mission. I was at Cleveland Clinic. And an interesting fact about me is second to my passion for medicine, I love to sing and dance. It's my second passion in life.
Hi everyone, my name is Johnny. I'm the treasurer, and I did my course in Danbury. I'm currently driving back from Chicago. I was in Mount Sinai for a critical care rotation, and then making the 14-hour drive back. My fun fact about me is that I'm interested in the space, and I do astrophotography on the side.
Hi, I'm Veronica. I'm the director of membership. I completed my course at CHS and just finished up my electives too. Um, Fun fact about me is with whatever book I read, I have to read the last page before I start it.
Hi everyone, I'm Autumn. I am this semester's regional coordinator. I did my course actually out in Michigan, and I am just finishing up today my first sub-I out in New York. I have another one coming up, so I will be out here if anybody is also out here. And my fun fact is, oh, I was a cheer coach for 5 years prior to going into medical school.
Okay. Alrighty. So we'll move on from there to just keep the flow, and we're going to talk about the Constitution next. So the reason why I want to present this to the general members is because we will be sending out in our next email the slides that we are presenting today with the active link here. So you'll be able to check the Constitution yourselves. It kind of gives some information for people who want to become part of the e-board, things like, what are the responsibilities for different positions, any grade point requirements that certain positions may have, how many semesters can you serve on the e-board as the Constitution dictates right now, different, positions that were recently added. And so you can see things that are missing and maybe even propose new positions that you see fit. And the reason why I bring that up early on is because a lot of the members in our team right now are actually fourth years graduating anytime, honestly, between now and November. So, come December, it's very likely that the entire clinical science e-board, with the exception of maybe one or two people, will be completely new. So we would love to have new people, and we wanted to advertise this starting earlier on, so you can kind of have that kind of brewing in the back of your head if this is something that you'd like to do. Okay. So, without further ado, we want to kind of just go over the different events that we have so far pending for this semester, or sorry, for this term. So we have our GBM that we're hosting today, and that's going to kind of, give you guys an idea of who the eBoard members are, as well as, we're going to do a Connecting with Clinicals event right after this that will be presented by Johnny, the secretary. And that's going to kind of go over more information about different types of fellowship opportunities that you can do, other career avenues that do not require a fellowship, more new, I guess subspecialties in OB-GYN, things like that. So please stick around for that as well after the GBM is finished. In August, we'll start with our regularly programmed scheduling with the fetal heart tracing lecture that's given by Dr. Dean. Dr. Dean is the faculty advisor for OB-GYN, and he will also be the one for anyone doing the 2027 match and looking for a chair letter. If you're doing it through Ross, he would be the one that completes that for us. And he's always willing, if there's time at the end, to kind of just answer questions from the student body in general. It doesn't necessarily have to relate back to his lecture. So this is just a great opportunity to reach out to him as well if you wanted to. After that, we are going to have a residence panel discussion. So this is where we will invite residents from, for sure, the last cycle, so the Match 2026, as well as we also try to include residents that are a bit maybe, further down their process. And what this allows us to do is it gives us a perspective from someone who maybe now might be contributing to making those decisions about who programs want to rank, right? And which students are being selected. So you get to kind of see the perspective of someone who just matched and what they did well on their applications, as well as hear from people who are kind of helping with the selection process. We're hoping to do it in August because I know that, residency cast, all of that stuff is due, right? The deadline is like September 17th, right? You have to have everything submitted, and programs will see it in September 23rd. So we're going to try and get that done in August so that, even if it's not super helpful for, let's say, the application, you also hear from them about the interviewing process. So I know that will be useful for a lot of us, myself included. After that, we're looking to do some suturing workshops in Cleveland Clinic, Florida. The eBoard members that are currently there will be hosting them. We're just kind of working around the, location, accessibility of suture kits, things like that, but we are planning to do that in August. Another event that we would like to host in August is an ultrasound sim lab that will be focusing on labor and delivery. I specify this because we are also going to be doing a sim lab in September, and that will be focusing on BPP as well as estimated fetal weights. These will most likely be occurring in different clinical sites, right? It really depends on at that time where our eBoard members who would be hosting them and kind of leading the events are located. So we will give you guys more details closer to the date and time. And hopefully many of you who are in those locations will be able to attend. But please keep an eye out on social media. We post to our Instagram as well as the WhatsApp chat for the clinical community, as well as send out emails. So once again, if you are interested in receiving those emails, please fill out the sign-in form and please indicate that you would like to be a part of that email list. Other things that we have scheduled is another lecture by Dr. Dean that he'll give us in September 2026. And I also like to host a virtual Jeopardy session. This is kind of geared towards people who are prepping for their OB-GYN shelf, as well as those who are looking to kind of do a quick review of OB-GYN before step 2. In October, we only have one thing so far, and that's kind of pending because we're still working with the company that was going to provide us with their IUD insertion kits. If you were part of the club last semester, you know that we already started it, but we got into a couple of hiccups. We're making more leeway with them in terms of are they able to give kits to, basically a non-US school is kind of what we're working through right now, but I think they're going to be able to help us out with that. And so we'll try to get kits for as many sites as we possibly can and host these events in multiple dates in October. And to end off our current term, we're planning events all the way up till November. So in November, EBOR members will be hosting virtual case simulations, as well as ultrasound interpretation workshops and crochet and knitting drives. That will be something that, if you feel so inclined, you can make like hats, things like that for premature babies. And we will provide you with the supplies. You would just kind of knit whatever you feel so inclined to knit or crochet, and you can donate it to either the hospital site that you are currently at, or you can also donate it to like a local shelter or anything that you see fit. But we will be providing the supplies in order to do that. So overall, to kind of give a little, recap of the community outreach that we've talked about so far, in-person volunteer events will include at site location, like at particular sites, women's shelters and homeless shelter outreach events. In terms of workshops and simulation labs, we have vaginal birth simulation, C-section simulations, suturing workshops, IUD insertion workshops, as well as estimated fetal weight, as well as biophysical profile sim labs that are currently in the works for the semester. And once again, please be, kind of registered on the email list, as well as be part of the WhatsApp group chat or follow us on Instagram so that we can make sure we get those dates out to you as soon as possible once they are finalized. Final thing that I wanted to go over in terms of community outreach is that we are currently working with Princess Marina Hospital in Botswana to do a fundraiser for supplies for them. Just a little bit of background is that I did my global health elective that can be done through Ross. And by the way, that is completely covered. You don't have to pay for your flights or anything like that. I had the amazing opportunity to do it in Botswana at Princess Marina Hospital. Amazing group of people. They really are passionate about helping their community, but that experience really does highlight the differences in care, especially when it comes to a resource limited setting, which is what that hospital is. It's a government funded hospital that kind of provides care for people mostly free of charge. But yeah, they have a lot of problems with accessing medication to the point like Tylenol they may not have in stock. So that kind of gives you an idea of, the current circumstances that they're having. I am working with their OB-GYN medical director in order to be able to raise whatever funds that we can as a group and as a student body. And hopefully, Ross can kind of donate to that and help them out, whether it's something small like buying, helping them purchase Tylenol, or right, it's could be something bigger depending on how successful our events are. We were thinking about doing runs, organizing something like that. So that's something else that we'd like you guys to keep an eye out for. And if you are capable of doing so, financially capable, that is, right? We would love it if you guys can support us. If not, come and participate in the event. That also helps a lot. Any way that you can help, that's amazing. But I also appreciate the fact that everyone here is a student, and we may not be able to help financially as much as we wish we could, and that is also completely fair and understandable. So yeah, overall, our 2026 goals and initiatives is what I want to talk about next. We want to make sure that we have more membership engagement. And so we're trying to do that once again by social media, group chat, and having in-person events. We want to be able to provide more new and innovative workshops and simulation labs. And finally, we want to create more volunteer opportunities for you guys. And that will look like volunteering at women's shelters or homeless shelters, right? And anything else that you guys suggest, we are also open to. So please do not think that this is all that the club has to offer. If there's anything that you think we're missing, that you see in another group, or you think that it would be amazing to have as part of the OB-GYN clinical interest group, please let us know. And we are more than happy to kind of think about that and see how we can fit that into the term. And if there are any questions at all, feel free to take a screenshot of this slide, or, write it down for later. This is our email. I check it, every 2 to 3 days. So if you have any questions, I try to answer as soon as possible, as soon as I see it. And I'm more than happy to answer any questions or address any concerns that anyone may have. In case no one has, if someone here has not yet joined the group chat, that is here as well. If you scan the QR code, it should take you to the group chat and you can subscribe to it. So that brings us to the end of the general GBM. The next thing that we want to do is kind of go over the connecting with clinicals portion. The majority of it will be done by Johnny, our amazing treasurer. He made all these amazing slides and did the research for it. So I'll let him take it away. At the end of that, there may be a little bit more questions in terms of administration and logistics that you have about OB-GYN and residency and what can the group provide. So I'll kind of take it over from him near the end. But for now, Johnny, please, you have the board. I'm just gonna, everyone, please forgive me. I still haven't figured out how to switch the screen without showing everyone my screen. So you guys are just gonna see yourselves for a second while I put myself on mute.
Alrighty. So this little portion is going to be talking about all the different things you can do with an OB-GYN residency. So where can it take me? We go to the next slide. There we go. All right, so there's three really things I'm going to talk about. Residencies that don't require a fellowship for you to start working. Specialties that don't require a fellowship, ones that do, and then new and upcoming ones that are interesting and different. So here's the bread and butter OB-GYN generalist. Pay and lifestyle they're all these pays and lifestyles kind of are going to be different. The pay is, it's always just a big number. So around 300 K plus. The generalist lifestyle is going to be frequent calls with deliveries and a mix of clinic and hospital work. However, the lifestyle now has become more shift work. So if you work in a group or multiple groups in a hospital, you would end up having coverage from other OB-GYN specialists who will cover for you, so you don't have to like sprint into the hospital, for your patient who's delivering. And they do, of course, C-sections, routine GYN and GYN surgery. Training's 4 years, and typically you care for the patient. Of course, the fetus immediately after birth, you get them for 2 minutes, and then they're not your problem anymore. And you can deliver the same patient's baby multiple times. So, or different babies multiple, different times. So you could have some continuity of care there. That's the bread and butter. So yeah, so the next one is the a laborist, so pay is a little bit less. Shift work, of course, being covered by other labor and delivery people. More predictable, of course. Schedule, deliveries, triage, inpatient things, right? And then it would be, of course, the regular residency in OB-GYN with an optional hospitalist training. And yeah, so that one is pretty much just inpatient only. But you would be delivering lots and lots of babies. But this would be like it says here, 5 to 10 babies back to back. And the next one, we've got GYN only. I was in Danbury working with Dr. Ivanovic, and he pretty much did GYN only clinic and surgery. So the pay is a little bit less here, unfortunately, but more predictable. No calls for OB, of course, because it's just GYN. And then the bread and butter of this specialty would be surgery, of course, pelvic pain, abdominal bleeding, and then you would follow up with your surgery clinic patients after clinic in clinic. This would still be a regular OB-GYN residency that you need, and you would have no call, of course, for this. And most procedures are non-urgent. And then here we have outpatient women's health preventive care. So this would be just clinic. Of course, amazing work-life balance, which all of us love. You would do well women exams, contraception, menopause care and screening tests. Same residency. And of course, the long-term patient relationships that you can build with this are very strong. This is generally the OB-GYN attending that you would be working with, academic. So they would be in a clinical and teaching, like a teaching hospital, doing a lot more research, of course, because you get more complicated cases. And then you would pretty much do the same thing that like regular OB-GYN specialist would do, except you're doing it in a hospital, in a teaching hospital. And like it says, you directly shape the future of all the students that you work with, and can make an influence on people beyond the patient. And then here's MFM. I got the pleasure of meeting one of them in Danbury, Dr. Zilberman. This lifestyle and pay is high pay, but high complexity. Lots of difficult conversations and planning, ultrasounds. And then depending on how your schedule works out, you may have to do call shifts for if you're managing your own patients. They do high-risk pregnancies, ultrasounds, they do consultations. This is 3 years of fellowship after residency, and very, like I said, lots of research. And this is the only OB pathway that manages ICU level medical complexity. So if you enjoy like an ICU rotation, you like critical care, high risk decisions, this is something you may want to consider. And then we have repro, endocrine, infertility. This is a high paying field, and it's pretty well sought out. A lot of people are having, unfortunately, reproductive problems more often these days. So a lot of people will end up needing this. This is office-based, no call, really. Infertility evaluations is the bread and butter, IVF, and any endocrine disorders that can affect pregnancy. And then this is a 3-year fellowship. And then this is kind of mixed bag, a halfway point between clinical and lab work. Gyn-onc, this one is also a high-paying field, but also very intense. It's basically as intense as like a surgery attending would have as a lifestyle. Um, they would have call. You would have all the inpatient workload, right? Oncology, oncologic surgery, which is of course more complicated than any other surgeries. Chemo, multidisciplinary cancer management. The training is usually 3 to 4 years, and they can administer chemo and can do like radical oncologic surgery. This is a very surgery heavy field. And then Urogyn pays well, clinic, OR focus. You get to follow up in clinic for your OR patients. Predictable schedule. You would be dealing with incontinence, prolapse, and reconstructive pelvic surgery through your fellowship, and combines urology and gyn. And you can work closely with other specialties to help you care for patients. The MIGS fellowship. So this is an interesting one. So I was actually really interested in this one. It's similar pay to generalists, and similar to the gyn surgery, except you're going to be using like the Da Vinci robot more often. So the bread and butter here would be advanced laparoscopic robotic gyn surgery. The training is 1 to 2 years of fellowship, and then it actually is going to become a 3-year residency or a fellowship soon, unfortunately, but if it needs to be, it needs to be, right? This one's really cool if you like working with your hands and if you're like very good with hand-eye coordination and maybe played video games. Yeah, so you perform very complex gyn surgery through the robot with minimal scarring and faster recovery after the procedure. And then you've got pediatric and adolescent gynecology. It's clinic-based. You would be pretty much consulting a lot in the hospital. And then you would be dealing with a lot of adolescent reproductive issues. And this one's pretty much a newer field. So I'm not sure, I don't know too much about it, but it's pretty much gynecology for younger patients. And then here's some other career subspecialties. There's menopause medicine, public health track. If you ever wanted to go into industry, now's your time. There's an option for that too. And then hospital admin. There is also, for those of us who haven't applied yet, the option of applying family med. And there is an OB track. It's like so with family medicine, a lot of people will dual apply family med with OB-GYN because you do get a lot of OB-GYN training. And if you do the OB fellowship after family medicine, it allows you to perform C-sections. So it's another route that I wanted to talk about, which I didn't know very much about. I'm also going to be applying family med. So this was something that is nice to see if it needs to, if it comes to that. But yeah, that's all the real options that an OB-GYN residency can take you, and I hope you guys learned something. Does anyone have any questions?
Okay, so we
All
will
right.
move forward from that. Thank you so much, Johnny. I just want to keep us going so that we
Yeah.
can get everyone done. I know it's a Friday night and we all are
Yeah,
probably either
absolutely.
studying, but I'm sure that was amazing. I actually learned a lot of different things about different, like, I guess, options. And I was like, you know what?
Mhm.
I would actually maybe enjoy doing that. So that's cool. Thank you so much for that.
Yeah.
And I'm sure, if anyone reaches out to us at our, club email, would you be open to talking to them further about this if they have questions?
Absolutely.
Okay. Awesome. So we will do that because I don't want to not give people a chance to ask their questions. So this said thank you too early. Last thing I wanted to do is kind of go over some other administrative points. Right. So day-to-day life of an OB/GYN resident, I'm sure you guys have seen with, all of the, rotations you've done, electives, that, it tends to be a blend, right? That they're working in the office, at a clinic, they're doing inpatient work, as well as they're in the OR performing surgeries and learning about robotics. So there's a lot to learn, a lot of different environments that you are exposed to as an OB resident. You could probably expect some long hours, right? And night shifts, some people do it a couple of weeks at a time and then switch. Some people, sorry, I shouldn't say people, some programs require that you do longer durations of time of night shifts on call. So it all really depends on the program that you go to. And we will have residents, Rossies that are successful in becoming OB/GYN residents, and they will be able to provide us with more information on that as well. And they can speak from personal experience as opposed to, me telling you guys by observation, which is something you guys already knew. Next bullet point that I wanted to hit was, okay, you want to go match into OB, or you're interested in OB and you're exploring your options, or you want to look at different programs, interact with people ahead of time. In America, right, the national board is called the American College of Obstetrics and Obstetricians, and Gynecologists. They host an annual clinical and scientific meeting. The next one that's coming up for 2027 is going to be held on May 21st to the 23rd. In addition to that, they also have district meetings. So districts is basically they take, all of the USA and they split it up into different districts. And each district, right, based on the states that are part of that district, will have their own events. So, let's say that, you're not able to make it to the ACSM, right? You can maybe go to your district meeting as well. There's too many to list, so I just kind of put the link here. Please feel free to copy and paste this when you get a copy of the slides later this weekend. We were also asked, to talk to you guys about what makes a competitive application. So competitive applications based on, just speaking to other residents in the past, have been generally, if you want to be competitive in terms of scores, you're looking at around a 252 on step 2. Bear in mind that a 250, right, is around the 50th percentile on step 2. Right, you want to make sure that your reference letters, right, are also, very strong. They're able to speak to who you are, not just as a student, but also more holistically, giving an idea of, what are your personality traits that suit OB/GYN as a, chosen field and a chosen specialty. And, it's not just your referees talking about that. It obviously helps if someone else can attest to that and say, hey, I've seen this, but you want to also bring that up as well in your personal statement. That's another important part of your application, right? As well as having research experiences if you can, especially if, you're someone who's thinking, I really want to do something academically focused later down the road after residency. We've touched on this before, but Dr. Robert Dean, is the advisor for our club. He's amazing to work with. He's really, caring, and he wants the Ross students to do well. He loves it when people want to match into OB/GYN. So this is his email here. As I mentioned before, he will be the one that's going to be filling out the chair letter for us if you decide to go that route. Please remember that I can't, sorry, someone else can maybe remind me, but the like beginning of August is the deadline to request a chair letter. So if you haven't done that and you're thinking of applying for the 2027 match, please make sure that you kind of go through the emails. If people don't have that email, they didn't see that email from Ross, please put that in the chat and I can see if I can forward it to our email list as well. So because there's a specific way you don't really contact Dr. Dean directly, you kind of go through the Office of Career Advising, and they're the ones who would be able to, give him the information to give us the letters. Networking. So as mentioned before, we will have the residency panel sessions, so please feel free to join those. We also have a WhatsApp group that we are using to connect with alumni for the match cycle. That, I guess, chat's QR code is currently on the screen here. I'll give you guys a moment to kind of scan that if you wanted to join that group as well. As I talk about the last point, which is that in order to kind of, show solidarity, a lot of us, as I mentioned before, a lot of us on the e-board are fourth years. We are applying for the upcoming match cycle. And so, sorry, we will be hosting a personal statement / residency cast meeting virtually. We will try to provide more information as it becomes available to us. If you have any questions about, how are we doing certain things and how are we preparing for them. And even if you're not looking for any information, if you just want to know that someone else is also working on their personal statement at the same time you are, or they're also trying to, do their application as you are, just to kind of be in solidarity with each other and provide that emotional support. We are trying to host those as well in the upcoming months before we have to all click submit on our applications. So that is everything that we have today. Thank you so much to everyone who joined. Hopefully you learned something. Hopefully this was helpful. And yeah, if you have any suggestions, any thing that you want the group to do for you guys, especially as we approach the match session, even if it has nothing to do with the match. If you are a third year that is here, that just started and you're not applying till 2028, but you have something else you want, please let us know and we will do our best to do everything that we can to make it good for our members. Yes, and I'm just kind of going through the chat. Yes, Tala, can you please put the sign-in sheet in one more time so that if people missed it at the beginning of the meeting, they can sign in right now.
I just sent it.
Yes. So, is there a way to change the e-board positions for one semester instead of 2 semesters to give other people opportunities? So, yes, and we are going to be sharing the slides. So the reason that we have the two, it's not 2 semesters, it tends to be 2 terms. So a little bit of background is we are coinciding our elections with the clinical student government elections. So we're having it basically the elections around the same time that they do, right? And that kind of happens biannually. So that's where the current guideline comes from. The other reason why we don't do positions, you can only hold that position for 1 semester, is because a lot of the positions, like for instance, president and vice president, if possible, we try to have someone who is already there for 1 term. So you are familiar with what the position entails, you are comfortable speaking with Dr. Dean, and it allows us to do an easier and smoother transition. Of course, if someone vacates a position in the middle of the term, etc., we do open it up. But that's kind of the background for why I personally and the team personally kept it as 2 terms, is so that we can give people a chance to kind of come into the group in one position, and then for the more senior positions, they can kind of take over from it from there. That's kind of the rationale, if that makes sense. If you see a better way to do that, once again, we're all ears. We would love to hear about that as well. But yeah, the current board has 3 old members and then I believe 3 new members. So it tends to be a good mix anyway of old and new people, of old and new members on the executive board. All right. So I'll stay on if anyone has any other questions, but if not, this is the end of our meeting. By the end of the weekend, we will send out the slides to you guys. Thank you everyone for coming and have a wonderful weekend. Bye.
Hi, I don't have access to the chat. Oh, wait.
Sorry, which chat?
To this chat, I think you said it was like a sign in.
Oh, to the sheet, the sign-in sheet?
Yes.
Okay, give me 1 second. Let me do that again. I'm gonna send it to you. It's not letting me repaste it, but I am going to try and send it again directly to your chat.
I
Okay.
just sent it. Can you check the chat again, see if it worked for you?
Okay. And I sent it to you directly as well. So
Okay, I got
which
it.
perfect. All righty.
Thank you.
Of course. Alrighty. Thanks everyone. Bye.